when they realized that the number of patients, COVID patients, may increase going to their private hospitals, they came with a proposal to say, let us build a facility in Lady Pohamba. They say that they will be able to raise money for that facility. But then, Lady Pohamba said, you can build it and it will only last for 12 months. Not more. Then you dismantle it and then you give back our space. Now, that was the beginning. And then they came to my office. We had a discussion. We said, look, we need to increase capacity. By that time, we were already preparing our capacity at Windhoek Central Hospital, Katutura, Oshakati, Wolf's Bay. We're already increasing. Then, when they came back to us to say, look, I think this proposal, somebody who proposed this thing did not understand the whole situation. We don't have money for that. And I have that one in writing.
Oh, okay.
So, the private sector actually pulled out in terms of funding, but they say, if we can get architects, other people to help you. Now, as a government, we said we may need this facility. So we asked the city of Windhoek to give us their Rhino garment factory. They responded in writing and gave us that permission. I have the letter. So now we said, okay, let us engage our architects and the other people to come with a concept paper and the cost estimate, which happened. And then, after that, I approached cabinet. We have this plan. And I also said we are doing this and this and this here and there. And then it was stated that, okay, for the time being, let us continue with the projects which are already in the hospitals. And then we keep this one. We are not cancelling it. We are just keeping it at bay until we develop the one in the hospitals and to see whether there will still be any need to continue. So that's what happened.
Okay. That's what that's what happened. What about private sector? Were they then involved in this idea? I mean, Dr. Haufiku mentioned places like Pukavit and SPA, and the fact that they were willing to provide funding towards these projects, but because the project was shut down, they also pulled out.
No, let me tell you the truth. The truth of the matter is, we were going ahead with the project together with the private sector. Initially, they said they don't need any funding from government. Then we move ahead. And then later, they came back to say, we don't have the money. And then government said, okay, if you don't have the money, we will continue on our own. You understand?
Yes, I understand, Dr. Shangula.
Yeah. So the government decided that we will continue with the project without the private sector, because the private sector, they say they don't have the funds anymore. Whatever was promised at the beginning, it was no longer available. Because it was not funds which were there, it was funds which were going to be raised through financial institutions.
How much are these funds that we're talking about that is needed for this project? And then maybe when do we envisage for this to be set up? Or are we just waiting for maybe the need arises?
Now, at the present moment, our initial projects, they are ongoing.
Okay.
We have, we are developing an additional 63 beds in Windhoek, an additional 63 bed in Oshakati, which was already in progress before the private sector came in.
Okay.
So we are proceeding with those programs. And I can assure you at the present moment, we do not have a shortage of beds.
Yeah, you told me yesterday.
Yeah, but I understand that in the private sector, they have a challenge when it comes to bed. But for us, we treat everybody, every Namibian who has got COVID in our facilities. They can just refer and they will get the best treatment.
Yeah. In terms of what Dr. Haufiku said with regards to assessing the level of readiness in the regions, what can you say to that allegation? I mean, he said that he had approached you to say we have acquired a private jet. Let us go to the regions and assess the readiness. What can you say to that, Dr. Shangula?
No. Yeah, when we are dealing with the pandemic, we need to pull all our forces together. We had daily meetings, daily strategic meetings, and I invite him as a special advisor in the office of the Vice President to be part of those meetings. So he was aware of everything we were doing. Now, what are the strategies? How do you go about it? We have regional directors, regional management teams who are dealing with the situation on the ground in those regions. Just like we have the same in Windhoek. Okay? So they got all the instructions, what needs to be done, how, what member to set up in their committees, and decide on everything. Now, if you want to go, what are you going to do? Now, just tell me. I ask for the terms of reference. What is supposed to be done, A, B, C? There were no terms of reference. Do we just use on aeroplane because there is one available, or is it going to serve any purpose? We had all the teams in place and they give us information on a daily basis. So we know exactly everything. There's nothing you can go and do unless you take an excursion.
Yeah.
There is no information which was lacking, which we can go and you jet in today, and today you come out and you think that you have assessed the situation. It's not possible.
Correct. I mean, that depends on what. Maybe he had a different idea in place. That's why he had suggested it, but I wouldn't know. But was he the head of?
No. Mm-hmm. Don't put that chick in the tongue.
Okay.
The fact of the matter is, COVID-19 is a disease.
Yes, doctor.
Okay? And COVID-19 is a disease like hepatitis E, is being managed by the Ministry of Health and Social Services. Okay?
Mm-hmm.
And the head of the ministry is the minister.
Yeah.
He give directives, he get advice, but not any member of the team which he has composed will say, I'm doing this separately.
Yeah. But what was his role?
I hope you understand.
Yeah, I'm understanding. But what was his role then with regards to the response, to being part of the response or the task force?
Yeah. Let me tell you one thing. There was nothing like a task force.
Oh.
We have a National Health Emergency Committee. It was expanded through government, to include both health and economic sector. The team analyze economic factors, epidemiological factors, and they advise what needs to be done.
Mm-hmm.
Okay? They work behind the scenes, and all decisions of government were based on that. And then cabinet will meet almost on a daily basis.
Yeah.
To analyze the information, so what regulation to take, what measure to take, lockdown here, unlock down here, etc., etc. It was based on sound evidence.
Yes, doctor.
And the cabinet was meeting almost on a daily basis until midnight, up to midnight.
So what was Dr. Haufiku's role in all of this? I mean, he was saying he was leading the task force, and we never really quite understood what that meant, or at least now we don't understand what that entails.
Okay. I don't know who put forth that narrative. I can only explain what was there, not what he says.
Okay.
What was there is COVID-19 is a disease. It's within the Ministry of Health and Social Services. Mm-hmm. The head of the ministry is the Minister of Health and Social Services. So the whole responsibility of COVID-19 management and control, like hepatitis E, like TB, like malaria, like whatever, all the diseases, is with the Ministry of Health and Social Services. We have structures in place. Okay?
Mm-hmm.
Now, when this came about, the minister has to take lead within the existing structures. There is nothing like a national task force on COVID-19 and a leader of that. There is nothing like that.
That was actually announced earlier in the year, Doctor.
That. I don't know who created that. It does not exist.
Earlier in the year, when we were still dealing with the pandemic, that was announced that he is the leader of the task force. That was his position. I remember we used to quote him as such.
Yeah, this is what I'm saying. I don't know where you got that from. Where did you get that? Where did it originate from? There was nothing like that. I don't know whether you created it as journalist yourself.
No, Dr. Shangula.
Because nobody came to nobody came to the ministry to ask what is the situation.
No, I think it was announced at State House. No. I remember very, very well one of the COVID briefings. It was announced that he is the leader of the task force. Even when he stood up to speak up at one of the briefings much earlier in the year, it was announced that he is the leader of the task force. So he will be responsible for responding. And then when things changed, then he was removed from that. Or he said he was banned from speaking to the media, one of the two.
Yeah, okay. Let me tell you, all the media briefings.
Yes, Dr. Shangula.
You, at the State House, I was present. Okay?
Yes, Dr. Shangula.
Up to now, let me tell you that Dr. Haufiku was a minister of health. Okay? And then I was asked by the president.
Dr. Shangula. Oh, okay, now I can hear you.
Okay, I was asked by the president to be the Minister of Health. Okay?
Yes, doctor.
He then got appointed as a special advisor in the office of the vice president, not in the ministry. Do you know that?
Yes, I know that too.
So he was appointed in the office of the vice president. And then it was said he can be seconded to the Ministry of Health, which I welcomed. Okay?
Yes, doctor.
All right. And then when it comes to his removal, I did a request to the president to say the situation within the team has become so bad because of ABC, and we would like if you can withdraw him from the Ministry of Health and Social Services to go back to the office of the Vice President. That's all what happened. But I don't want to go into the details as to what happened, what he did, what other people were saying about him, and whatever. I don't want to go into those details.
Understood, Dr. Shangula.
Yeah.
But but before leading to his removal from your ministry, what was the relationship like?
With who?
With Dr. Haufiku.
With me?
Yeah.
Dr. Haufiku, with me, we had a very, very good collegial relationship. I would call him to tell him that, look, these are the problems. What are you doing? People are complaining about this and this and this and this. So please change. We have we never had animosity between him and me from my side. I would call him. When I get this thing, I will call him. And then we talk. And then I say, please change. And but it seems this thing kept on continuing, coming back, until there was the situation within the team was so bad. Yeah. So then okay, say if you would, okay, what do you do as a manager? Now you have this, you have done this, you have done this. It's not helping. Maybe can this person maybe, you know,
be
withdrawn?
Moved. Yeah.
And there was a lot of consultation, and there was a lot of cautioning. Can we? Why do you do this? Why is this? Why is this? And the whole thing is that you have a pandemic. One thing you don't want is conflict within a team, which is responsible for controlling the pandemic. And I can tell you that up to now, I have never had any problem.
No problem within the team that deals with the pandemic?
Up to now, since June up to now, I've never had a problem. Nobody came to me to complain. Nobody came to say this is doing what and what. But it was almost a daily occurrence. Okay. So the team is working very well, and they are addressing the issues within the limitation of the resources available.
Right. So lastly, Dr. Shangula, are you satisfied with how we are dealing with the pandemic, despite the second wave and also, you know, more deaths being recorded and so forth?
I'm not satisfied. I don't want to lie. I'm not satisfied. Today I will announce another 2 deaths. I will only be satisfied if I say today we are reporting 0 cases. Today we are reporting 0 deaths. That's the only time I will be satisfied.
All right, Dr. Shangula, thank you for this interview.
Thank you very much.
Yeah, enjoy your day. I just try, even though it's...
When are you going to publish this?
Today.
But Namibian is not going out.
Online. We have the online platform. We are still working online.
I don't think I have that one.
No, you should see Twitter and Facebook.
Okay, forward it to me.
Okay, I will surely do so, Dr. Shangula.
Yeah.
All right, thank you
Just
so much.
forward to me so that I can say that you have accurately reflected what I told you. If not, I will call you.
Yes, I know for sure. All right, doctor.
Okay, bye.
Bye.